Good morning. It's now been more than 2 months since we've had a case of COVID-19 in Prince Edward Island. And in the midst of this global pandemic, this is truly remarkable. Thank you, P.E.I. Thank you for listening and caring. Thank you for your patience and understanding. As we continue to renew P.E.I. together, increasing our gathering size and balancing health, social and economic decisions, we do anticipate new cases, and we've said that before. But we have planned for this as we learn to live with COVID-19. And when and if we do get cases, I know we'll all be disappointed and maybe a little anxious, but we are prepared to respond and do so quickly. And with things like our operation isolation, our contact tracing, and our testing, we will be ready. Today marks 6 months since the World Health Organization received a report of a cluster of unusual pneumonia cases in China. And we continue to learn about this virus based on our own experience and that of other provinces and countries around the world. And although the transmission is largely under control in Canada, it has not gone away. We know the virus still has a lot of room to move, and globally it is speeding up. As I just mentioned, we can expect COVID to appear or reappear at any time. But we have learned that public health measures, such as our physical distancing, keeping our circle of contacts small, and our good hand washing, cough etiquette, staying home when you're sick, are effective in reducing the transmission of COVID. And we've also learned the importance of remaining vigilant. We've learned the importance of taking steps to protect residents and staff in our long-term care and community residential facilities. We have learned how important it is to quickly identify and quarantine cases and contacts. And we know that contact tracing is more manageable if cases have not had recent close contact with a large number of people. And we'll continue to learn to live with this virus. Around the world, there are 10.3 million cases now of COVID-19 and over 500,000 deaths. Yesterday, the World Health Organization announced a record high of 189,000 cases worldwide in a single day. We know that the first wave of a pandemic is winding down in Canada, but this is not the case in many other countries. In Canada, there are 103,000 cases and more than 8,500 deaths. In P.E.I., since last week, we've had almost 1,400 new negative tests. In terms of operation isolation, currently there are 1,156 people in self-isolation, and 6,300 have completed their 2-week self-isolation. In terms of travel approvals, 1,900 essential workers have been approved to travel to P.E.I., and 1,600 compassionate approvals were granted, including 237 under family support. We've had a total of 728 seasonal resident applications who've arrived in the last 2 weeks. As Phase 4 of Renew P.E.I., it started last Friday, June 26th. Larger organized gatherings of up to 50 people are now permitted. And these are for things like worship services, organized sports, day camps, and events like weddings and funerals. And with approval of an operational plan, an additional group of 50 will be considered as well as part of a multiple gathering. And I know some are wondering when it will be possible to have even larger organized gatherings. And I think it's important for us to watch the impact of what measures we've already put in place and the Atlantic bubble before we make too many more steps forward. Long-term care has expanded visitation to include indoor visits, and that was announced last week. And the visitation policies are facility-specific and even health P.E.I. specific, but the common principles of keeping the number of visitors small, arranging visits in designated spaces, and often visits are by appointment. Nursing homes can take residents out for drives, and residents of community care facilities can go on drives with their own families. There has been much discussion throughout Atlantic Canada since the announcement last week of an Atlantic bubble. So beginning on July 3rd, travel between P.E.I., Nova Scotia, New Brunswick, and Newfoundland and Labrador without self-isolation requirements will be permitted. So each person who is traveling into Prince Edward Island, so these are residents of Nova Scotia, New Brunswick, Newfoundland, they will be required to submit an online declaration so that their submission can be verified at the point of entry. And public health officials will be verifying travelers at the point of entry. And we're asking people to print off that self-declaration if at all possible. The declaration form will be available on our website on July the 2nd, and applicants are encouraged to apply no more than 1 or 2 days ahead of time before coming to P.E.I. And this really has to do with the questions that are being asked about if you're feeling well and if you've had contact with anyone who may have had COVID. P.E.I. will begin welcoming other Atlantic Canadian residents under the bubble in the wee hours of July 3rd. So all inbound residents of the other provinces in Atlantic Canada will undergo a health screening at their point of entry, and an information pamphlet will be provided to travelers outlining P.E.I.'s public health restrictions. Staff are putting resources in place to deal with an increase in traffic and visitation to the province, to try as much as possible to avoid delays at the border. We encourage people who are planning to come to P.E.I. to consider traveling at perhaps off-peak times. And I have a few messages, because we're getting many questions, for islanders who are planning to travel as part of the Atlantic bubble. And I know there are meetings going on today to confirm some of the information of what will be required for islanders when they go to New Brunswick or Nova Scotia, for instance. They will likely have identification required, and we will await details on what is required as they go into the other provinces. Every province has similar public health restrictions, but there may be some differences. For example, masks are required in some public settings. So if you're traveling to Nova Scotia, New Brunswick, or Newfoundland and Labrador, I encourage you to take a mask with you in case you need it. If islanders are traveling to other provinces as part of the bubble, they will not be required to complete a declaration when they return to P.E.I. However, they will have to complete a health screening form at the point of entry, so you will still be asked questions. But if a member of my family was to go to Nova Scotia, for instance, when they came back, they would not have to fill out a declaration form for Prince Edward Island, but they would be required to show identification that they are island residents. Islanders should not travel within the bubble if they are sick. And it's very important that islanders continue good hand washing, physical distancing, and other public health measures we've had in place. It's important we all remain vigilant and know our risks. Self-isolation is still required for anyone traveling from an area outside of the Atlantic provinces. We will continue with the Operation Isolation for individuals who are in P.E.I. and are required to self-isolate for 14 days. Screening will continue at the bridge, ferry terminals, the airport, and other points of entry to ensure that those needing to self-isolate have the support to do so, and that everyone is well aware of our restrictions. I know there may be mixed emotions about the Atlantic bubble. as some people are excited to reunite with family and friends, while others may be feeling nervous about opening up P.E.I. And I share in those mixed emotions. As we progressively move through this renewal process, we cannot completely avoid risks, but we can assess these new risks cautiously and safely. I hope we will all be safe. Those who live here, work here, and want our children to go back to school in September. And we want those who are here to live temporarily or visit also to be safe. We need to continue to be a welcoming province to our family, friends, and neighbors. Tomorrow we celebrate Canada Day, and we should be thankful for how we, as a country and as a province, have confronted and as provinces have confronted and contained COVID-19. We are all learning and navigating this new way of life together day by day. And we can continue to practice the very basics that we've talked about. Please be safe. We know what we need to do to protect ourselves, our families, and our community. The Director General of the World Health Organization said yesterday in an address, all over the world we have seen heartwarming acts of resilience, inventiveness, solidarity, and kindness. And P.E.I. is a great example of this statement. We should continue to look out and look after one another. Let us continue to be patient, generous, and kind. Thank you. I'll open it up for questions, and then I'll try to answer the questions in French as well.
Brian Higgins, CBC.
Hi, Dr. Morrison. Can you tell us more about what the procedure will look like on Friday as traffic from the mainland starts to come across the bridge? Where just describe where the screening will take place and who will be doing it, and things like that.
Well, hi, Brian. So when people are arriving onto the island, there'll be basically there'll be someone to identify if you're a trucker going into perhaps one lane, and some essential workers. There'll be and with the help of pylons as well, going into certain lanes for islanders and visitors from the bubble. They'll be directed into different lanes. So one will go right into almost Gateway Village, and you'll be some towards the Way station. So some people are more familiar with the setup up there at the Borden area. And we're working with the people at Confederation Bridge, Highway Safety, our public health office, really a large group of people trying to make sure that we can, we figured out how many minutes on average it takes to screen a vehicle, and we've already have experience doing that, and then trying to make sure that we continue to get the vehicles through safely, but still have a chance to screen and identify those who are coming in from outside Atlantic Canada, and those who may need to self-isolate. So it will, they have tents set up as well up there for the many people who are going to be helping work the different lanes. They were anticipating up to 3 screeners per lane. And again, this is based on anticipated traffic. And we looked at last year's traffic in July and know how many approximately were from Atlantic Canada. And I've been trying to work out some of the logistics around that. And if for some reason someone does arrive and doesn't have a self-declaration form, then there will be a lane or area to sort of go into, and that will take a little bit longer, but then can be dealt with at that time.
Thank you. And for islanders who are leaving the island, what should they expect when they're trying to get to the mainland similarly?
And I think, Brian, they're working on some of those details today. I anticipate, for instance, if you're going to New Brunswick, I anticipate there may be a self-declaration form that islanders will need to fill out to go into New Brunswick. And I think that information will be available on the website and publicly. I have a call with my counterparts later on today, so I'll probably learn more details for what their requirement, but that is certainly my initial understanding. And then islanders should have identification, of course, to show it when they're going into New Brunswick, but also when they come back to Prince Edward Island. I know there's a meeting underway right now, and they're discussing, trying to see if we can use the same types of identification, for instance, whether it's a driver's license, so that can be consistent amongst all the provinces.
Thank you.
Louise Martin, CBC.
Hi there. Good morning, I guess maybe good afternoon nearly to you, Dr. Morrison. I'm just wondering, I spoke yesterday with a group called the Restaurant Survival Group, and they were putting together some requests to loosen some of the restrictions in restaurants, including a larger capacity, maybe allowing more people at tables, less distance for social distance, maybe 1 meter to 1.5 meters rather than the 2 meters. I'm wondering if you've had a chance to see those requests and any response you have.
Hi, Louise. So I did receive a letter yesterday from them, and so I have seen the request, and we have just let them know that we will be looking at that and that we will be meeting with them. I don't have a time yet to have a follow-up discussion, but we'll meet with them. We've had a number of concerns, actually, speaking of restaurants, come into our office that around concerns that some of the restaurants, particularly on the patios, are not keeping the 6-foot distance, and that is of concern for a number of people who are observing that or are eating in those environments. So we will also be wanting to talk to the restaurants about that concern. And when we see what's going on in so many other parts of the world and what measures have had to be sort of put in place when things opened up really quickly, I think we have to take that into consideration. So, but absolutely, we've always enjoyed working with the Restaurant Association and the groups other groups representing restaurants in this province. So we will be looking at that and having follow-up conversations.
Thank you so much. And my second question is about the testing for seasonal residents. You mentioned in the last week you've had a number of over, I think, did you say 1,500 or 1,600 negative tests come back? I'm wondering, I know that there's a requirement for seasonal residents that they can be they're tested, or one person per household. Are those tests mandatory, and can residents actually, or seasonal residents, deny or refuse getting a test, or is it mandatory that they be tested?
So, I mean, as you know, we've had thousands of people in self-isolation already in Prince Edward Island. And in terms of the seasonal residents that have come in, we've asked to have them tested. It is not mandatory, but they will not be able to leave self-isolation at any way and for any reason anyway until their 14 days is up. So the testing was an additional measure of, and really in the country it's often for often just testing should be done for symptomatic people, but we have done that as an extra measure here. But if someone refused it, we would want to make sure they stayed in self-isolation for the complete 14 days.
Thank you very much.
Okay.
Appreciate it.
Alison Jenkins, The Guardian.
Yes, good morning. I have a couple of questions about the arrival, the opening of the bridge. You said the wee hours of July 3rd, so is it indeed 12:01 on July 3rd?
Yes, yes. It's at 12:01. 12:01. Yeah.
And I'm just looking for the has there been an uptick in violations or enforcement activities for people who have been out and around when they should be self-isolating? I'm hearing rumors.
An uptick in violations, not significant. As far as I understand, I had the numbers here, enforcement numbers here given to me earlier. I'm not sure I have them right now, but we've had gradual increase in number of complaints, follow-ups to people's residents. We've had fairly significant number of warnings. We've had a total of 22 charges that enforcement have laid. So that number has over the last number of months grown, but it's not jumped up significantly, no.
Okay, thank you very much.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. J'ai une question pour vous par rapport à la bulle atlantique. Il y a des provinces comme Terre-Neuve et Labrador qui ont l'intention d'ouvrir leurs frontières beaucoup plus larges, peut-être à tout le Canada, d'ici la fin du mois de juillet. Ça voudrait dire, en principe, que des insulaires pourraient se retrouver en contact avec des gens qui viendraient d'ailleurs au Canada et qui ne se seraient pas isolés. Quelles inquiétudes est-ce que ça suscite de votre côté, cette possibilité-là? Et est-ce qu'on va revisiter la bulle plus tard s'il y a des provinces qui décident d'aller dans cette direction-là?
Bonjour. Alors, on parle déjà quand la boule atlantique, est-ce que ça va devenir une boule canadienne? Et puis, pour moi, et puis je pense ici à l'île du Prince-Édouard, on doit regarder qu'est-ce qui arrive dans les prochaines semaines avec la boule atlantique pour voir le nombre de cas, s'il y a un grand nombre de cas ou non. Et puis, on regarde aussi qu'est-ce qui arrive sur la frontière des États-Unis et au Canada. Et puis, maintenant, c'est fermé, mais si il fait une décision avec le gouvernement fédéral d'ouvrir la frontière, ça va peut-être créer plus d'inquiétude à propos de la boule atlantique et canadienne. Mais la boule est toujours un peu fragile si on voit un grand nombre de cas, mais j'espère que ça ne va pas arriver. On voit le nombre de cas qui diminue partout au pays et j'espère que tout va aller bien.
Merci beaucoup.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. J'ai une question sur la phase 4 et les réouvertures qui ont lieu. Juste une question sur les cinémas. Est-ce qu'il y a aujourd'hui une date prévue pour la réouverture des cinémas à l'île du Prince-Édouard?
Bonjour Laurent, c'est une bonne question. Maintenant, j'ai pensé peut-être qu'ils ont la chance d'ouvrir s'ils ont moins de 50 personnes, mais je vais en discuter avec mon équipe et pour voir s'il y en a une date, parce que sinon, j'ai pensé que c'était peut-être déjà fait, au moins qu'ils ont assez de... le nombre n'est pas trop grand, mais sinon, je vais avoir une réponse pour la semaine prochaine. Ou même, je peux envoyer un email.
Oh, merci beaucoup.
Ok.
Et j'avais une autre comme ça sur les restaurants. J'ai regardé les Public Health Guidance pour les restaurants et le port du masque est recommandé. Est-ce que pour les serveurs ou les serveuses qui apportent la nourriture à table, est-ce que ce port du masque est juste recommandé ou est-ce qu'il est obligatoire?
Les masques sont recommandés, ils sont pas, c'est pas enforcé, mais et puis à ce moment, je pense que si on voit les cas dans la communauté, ça va peut-être changer, mais à ce moment, c'est recommandé seulement.
Merci beaucoup. Bonne journée.
Bonne journée. I'll just take one moment. I was asked a question about the Canadian bubble and whether we were anticipating really if other provinces in Atlantic Canada are considering the Canadian, expanding the Atlantic bubble to other Canadian provinces. And at this point, I'd like to see how things go in the next 2 or 3 weeks with the Atlantic bubble. I also think it's important that we find out what's going to happen with the Canadian-U.S. border, given what's going on with our southern neighbors, and that will be a federal government decision. But I think that what happens in those areas will influence our decision or our feeling about the expansion to other provinces at this point in time. And the other question was around in restaurants, we do recommend masks for people if they're going to be within 6 feet of each other in terms of staff, but it is a recommendation, it is not mandatory at this point in time, but that will change if we see a change in cases.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Vendredi, c'est donc l'ouverture de la bulle atlantique. J'aimerais savoir avec vous quelles vont être les procédures au pont de la Confédération pour que ce soit contrôler les personnes qui arrivent à l'île du Prince-Édouard. Comment tout cela, ça va fonctionner? Quels sont vos conseils? Est-ce que les visiteurs doivent s'armer de patience?
Bonjour, oui, on demande un peu de patience des visiteurs et les insulaires qui, s'ils sont en train de retourner à l'île du Prince-Édouard. Les voyageurs qui viendront à l'île auront besoin de compléter une déclaration en ligne et devraient, si possible, l'imprimer et puis montrer au personnel de la santé publique au point d'entrée de la province. Et cette déclaration sera en ligne le 2 juillet sur le site Internet. Et puis on est on a beaucoup de monde qui travaille tellement fort pour s'organiser avec les lignes pour être un processus assez rapide, mais on ne sait pas exactement le nombre de voitures, mais alors on demande la patience, mais ils s'organisent très bien et j'espère que tout va dérouler comme il faut.
Docteur Morrison, est-ce que cela va être possible pour la province de refuser des visiteurs à partir de vendredi au pont de la Confédération si le contrôle s'avère entre guillemets négatif? Est-ce que les agents pourront renvoyer des visiteurs au Nouveau-Brunswick?
Maintenant, ils peuvent les renvoyer aussi si ils ne peuvent pas montrer l'identification, ils n'ont pas, ils n'ont pas complété la déclaration en ligne. Il sera mis peut-être à côté s'ils veulent le compléter en place. On espère que ça ne va pas arriver souvent, mais s'ils doivent en faire, ils peuvent le faire comme ça au lieu de retourner. Mais si quelqu'un arrive d'ailleurs des États-Unis, ils n'ont pas la permission d'entrer, ils vont être retournés de l'île du Prince-Édouard.
Donc, si je peux préciser, un touriste du Nouveau-Brunswick qui arrive au pont de la Confédération peut être retourné aussi à partir de vendredi?
S'ils n'ont pas une identification, ils doivent montrer qu'ils sont résidents de Nouveau-Brunswick. Et puis, ils doivent remplir la forme. Si je comprends ta question.
Merci beaucoup.
Okay. I think that's it. I think the last questions were really about the travel over, and if someone didn't have identification with them, would we let them on? And really, that is going to be a requirement to have identification and the form complete coming to Prince Edward Island. So happy Canada Day, and we'll see you next week.